Okay, it's 5 o'clock, and we will start the meeting for the Health and Human Services Board for June 17th, and I will call the meeting to order. Colleen, you want to take roll, please?
Kathy Leaf.
Here.
Kara Koch.
Here.
Dave Osnes. Here. Scotty Ard.
Present.
Greg Telejohn.
Here.
Paulette Anderson. Here. Deb Lindemann. Natasha Ward.
Here.
Paul McGinnis.
Here.
We've got a full board tonight, so thank you very much. Everybody had a chance to look at our previous minutes from May 13th. Are there any additions or corrections? Seeing none, those minutes will stand as approved. And we will move right on into public comment. And we will open that up. John Strom, please.
Thank you, Mr. Chair. My name is John Strom. We live in the town of Forest, St. Croix County, Wisconsin. Congratulations and welcome to all the HHS board members. It is wonderful to have some familiar faces back. I hope to get to know the new members. Our issue is large wind turbines and health issues. Please contact me if you have any questions regarding wind turbines. I included my email address. There were previous efforts by this board to communicate with the Wisconsin Public Service Commission regarding the report from the Wind Siting Council due out in October of 2019. Is there a report? Is there any response from the PSC? Is there a Wind Siting Council? Have all the required members been selected? Is there any information to share? I'm including a link to a short video. It's about 5 minutes long. This is from the Shirley Wind Farm area in Brown County, Wisconsin. This is a good overview of issues. In addition, there are some very good scientific measurements that were made at the Shirley Wind Farm in December of 2012. And that's out online, you can Google that. I watched a video in October of 2014. Dr. Tibbetts was on the Board of Health. He is the reason I started speaking at the St. Croix County Board of Health and Human Services, and you will see him in that video. I will talk more about the measurements at the future meetings. I hope everybody had a chance to look at this video. If you haven't, I hope that you will. Thank you very much.
Thank you, John. Is there anyone else wishing to speak to anything on or off the agenda? Third time, is there anyone else wishing to speak to anything on or off the agenda? Okay, seeing none, we'll move on. Board members, if you don't mind, I'm going to take just a little break before we get into our business items. And I would like to introduce our new HHS Board Director is here with us in the boardroom. And Bob, do you want to say a few words about yourself?
Sure. Thank you, Chair Osnes. My name is Bob Raritz. I think I've met some of you or most of you previously, but just a quick background of where I came from. I most recently worked in Hennepin County as an administrative manager there, and was involved in many of the county's efforts in emergency responses to COVID-19, behavioral health, the homeless situation in Minneapolis, and many other issues more recently related to the protests and things of that nature. So that's where I came from to St. Croix County. Prior to that, I've worked in other county government and have a history in nonprofit management and in working with people with addictions and mental health issues, as well as people who are homeless. I'd be happy to answer any questions you have. Just quickly, my wife and I and our daughter Molly live near Hammond, and we're very happy to be here in St. Croix, and I'm very privileged to have this position and be able to serve the people of St. Croix County. So thank you.
And thank you, Bob, and welcome again. And it's very obvious in the short amount of time that you've been here, when you made the comment one day very early when you started that your door was always open. We've had a number of conversations since that time, and your door is always open, and I do appreciate that. So, and we can't be too hard on you because you are still smiling, and that's still another good thing. So, thank you. The other gentleman I would like to introduce is our new Public Information Officer. Please introduce yourself to us all.
Thank you, Chair Osnes. My name is Adam Kostanek. I am the new Public Information Officer with the Administration Department for St. Croix County. I also come from Minnesota state government, so I used to, prior to this position, I was the Content Manager and Website Administrator for Minnesota IT Services. As part of that, we did a lot of work around COVID-19, particularly in the IT sector, making sure everybody had the resources they need to telework, and also heavily involved with the Minnesota State Portal website and information for all state of Minnesota employees and residents. Prior to that, I have a little bit of experience in everything with communications, so video production, digital marketing, graphic design, copywriting, a little bit of everything. Since I started, I've worked almost exclusively with public health, so Kelly and Lori, but I'm looking forward to working with the rest of you and getting to know all of you.
Very good, and welcome.
Thank you.
In the short amount of your time, we put you to work big time with Kelly and Lori, and you're still smiling, so that's the good news too. So welcome again, though. And we thank Pat for being here tonight. We may have some questions, but that's okay. I'm sure you can answer them. Sure. And you're smiling so far too, so it's a good night for the council. There you go. All righty. We're going to move on to item number 1, which is open participation, public participation. Every year at this time, we open it up for public information, whether written or they can come in and voice their opinion on our budget, Health and Human Services budget report for the following year. And so we'll get right into that one. Duana Bremer is here from Grace Place. Duana, you want to come up and give your comments?
Many of you in the community are familiar with Grace Place. We provide shelter for 64 individuals. The thing that most people don't know is we also have 24 scattered sites that are allocated to folks that have been chronically homeless, which means homeless for a year or a 3-year period equaling a year. And those homes are for folks with mental health issues. So there's 2 conditions. They need to be chronic, one, and then they do have to have a mental health condition. And I just wanted to take a few minutes to paint a picture of what some of these clients look like. I think a lot of times we look at numbers. Of course, like most of you are aware of, I would love to see much more funds going into mental health in our community because we need it. But here's an example of something that happened at the shelter last week. And this is not just a last week thing, it's something that comes up all the time. We had a gentleman appear at Grace Place. He was walking to the shelter in the pouring rain. And I know this part's unbelievable, but a good Samaritan picked him up and drove him to the shelter. He arrived at Grace Place. We, of course, gave him a warm place to stay. He started talking to the staff and hallucinating, thinking he was in Washington, D.C., wanting to go to Washington, D.C. We contacted Northwest Connections. They spoke with him on the phone, and they said they would like to do an assessment via video. We took him to the hospital. They did the video assessment. He was diagnosed with schizophrenic. They gave us meds for 10 days. Now, he has no medical insurance. So Salvation Army wrote a voucher because we didn't want him to be off of his meds for 10 days. We wrote the voucher. And the plan, of course, from the hospital was that he would get in to see someone. He could not get in to see anyone because he didn't have any insurance, and we could not explain to him and assist him with Badger Care because he didn't know what we were talking about. The 10 days passed. The symptoms continued. St. Croix County could not provide the service because he was not a resident from St. Croix County. On the 11th day, the client attempted suicide, went to the hospital, had 15 stitches, was returned to Grace Place. And my point is that a community, we can do better than this. This is not good enough, and we can do better. So I wanted to paint the picture of someone that is going through these things that are in our community. So hopefully more funding would be allowable for mental health.
Thank you very much, Luana. Is there anyone else wishing to speak or make a public comment at this time? Okay, and then I want to turn it over to our vice chair. She's got a couple of things that we need read into the...
We have a couple of letters submitted for this public participation part. This one is from Nicole Swanson. She's with Accurate Imaging. She provides services at the St. Croix County Healthcare Campus, and she would like the statement read. We provide on-site digital portable diagnostic services, X-ray and ultrasound. We have been in contact with St. Croix County since 2008. We look forward to continuing our services for the residents of the healthcare center. Please feel free to reach out to me for any questions that may pertain to your budget planning. Nicole Swanson. And then we have another letter submitted by Agnes Ring, who is Executive Director of Family Resource Center, St. Croix Valley, which is located in Baldwin. Honorable members of the HHS Committee, I would like to thank the St. Croix County Health and Human Services Committee and Director Fred Johnson for the invitation to provide you with information about at-risk children in St. Croix County and share how valuable services provided by Family Resource Center St. Croix Valley make a positive difference. We appreciate the strong working relationship we have with the Health and Human Services staff. Background: Family Resource Center St. Croix Valley's mission is to strengthen children, families, and communities through education, resources, and support. We serve families with children prenatal to kindergarten entry. We are a nonprofit organization funded through contracts, donations, and grants. Our program has 4 components: personal visits, group connections, child screenings, and resource referral network. Here's a short history. Family Resource Center St. Croix Valley was founded in 1998 in response to a St. Croix County needs assessment with input from public health and social service providers. In 2005, we partnered with United Way, and the Success by 6 initiative was born. This led to many opportunities for collaboration, including parent educators providing one-on-one visits with families, delivering babies at 6 partner hospitals. We focus on evidence-based programs. For example, we are a Blue Ribbon affiliate of Parents as Teachers, an evidence-based long-term home visiting model designed to support parents as their child's first and best teacher. Our services area includes 3 counties: St. Croix, Pierce, and Polk. We have 9 parent educators who hold bachelor's degrees and professional credentials in human development and family studies and social work. We invest significantly in professional development and participate in continuous quality improvement initiatives with other programs in Wisconsin. Outcomes. There's a saying that if you can help a child, you don't have to spend years repairing an adult. Research suggests that early childhood development is the best economic development investment a community can make. There's a little quote by Art Rolnick from Humphrey School of Public Affairs. If done right, high-quality, parent-focused early childhood development programs that begin at birth can make an extraordinary difference in outcomes for both the child and society. When we talk about high-quality programs, we mean home visits, and we mean parent education as well as child education. Our parent educators help families create a home environment that helps increase parent knowledge of early childhood development and improve parenting practices. provide early detection of developmental delays and health issues, prevent child abuse and neglect, and increase school readiness and school success. In St. Croix County Services, in 2019, we served 69 St. Croix County families with 576 home visits. We met 578 families with newborns through one-on-one hospital visits, sharing information about resources and abusive head trauma. 9 families experienced 30 one-on-one positive parenting program sessions with a parent educator. 171 parents and children participated in group connections led by parent educators. We appreciate the financial support of St. Croix County and the opportunity to work with you on the front lines with families, focusing on the attitudes, beliefs, and behaviors of the adults who surround our children. We ask for your continued support. In closing, we would like to express our appreciation for the work of Fred Johnson. We are grateful for his partnership and leadership and for the positive difference he made for children and families in the St. Croix County. We look forward to working and meeting with Bob Rurat in continuing our partnership with St. Croix County to increase the odds that our at-risk children will succeed later in life. Thank you for your consideration. Family Resource Center, Agnes Ring.
Okay, and I thank both of those individuals as well. We'll move on to item number 2, please. Communicable Disease Surveillance and Control Report, COVID-19 presentation. Kelly?
Hi, good evening, everyone. Hang on. Give us 1 second. Okay. Okay, next slide, COVID-19 update. Thank you for letting public health address you all in giving you a report on our busy 4 months we've had. It's 4 now, not 3. I keep saying 3. It feels like 12. As we journey through the response, non-pharmaceutical interventions still serve to be our best defense against controlling and spreading COVID-19. You have all seen this slide before, and we've just made a few additions about wearing cloth face coverings in public if able, staying home when you're sick, which was on there before. There is information related to our current St. Croix County Health Advisory, which was put into place on May 13th, sorry. Next slide, please. Because there are new members on the board, and welcome all of you who are serving as new members on our HHS board. You have seen this slide, but I just want you to know about which state communicable disease or which state statutes really define the duties and powers of a local health department in the state statute, as well as administrative rules. So there they are, chapter 252. If you haven't read it and memorized it yet, you should. No, teasing. And then administrative rules can also be found in the government on the Wisconsin website. Sorry, next slide, please. So also one of the things in state statute is the role of the Health and Human Services Board. It is the role of health and administration and supervision can be found in chapter 252. 251 defines local health officials and guidance on what, not guidance, law on what a local health official should have as far as qualifications. And then administrative rule 140 really talks about communicable disease and controlling the spread and information related to the duty to report, different entities having a mandate to report certain communicable diseases to local health departments. And COVID-19 is one of those category 1, we call them reportable communicable diseases. Next slide, please. So we've tried really hard, and we continue, our job isn't done. We continue to look at the data that we are displaying for boards, people internally in our county as well as externally. Right now, to date, we have 122 cases. I just got word that one came in about 5 o'clock. So you have yesterday's numbers. So all the data I'm going to talk about tonight is really yesterday's data. So things would have a slight change if it was today. So before 5 o'clock today, we had 121 confirmed cases and 94 total recovered cases. The current dashboard, is being, we have a nice collaboration with a GIS specialist, and I'm not sure that's his exact title, but Joe Ayers with Community Development has been fantastic at helping us with this specific platform. And we have gotten quite a bit of positive feedback about thank you for putting numbers out. Certainly some questions. I do just want to let everybody know I'm on a lot of community meetings, and I'm sorry if you've been on one recently where you've heard me say this. Our hospitalization data is not where I want it to be, at least as far as displaying it for you and in an easily digestible way. It's confusing, and we have been working on that. I think we've had conversations every day all this week about what we can do to improve that. Those conversations have to happen at different levels. They have to happen at our staff level, so staff understand where they need to report this data and how often they need to be updating the data, as well as then how do we display it in a manner that is easily digestible. I will let you know that on the bottom right-hand corner of the screen, there are graphs related to cases and when we received reports of the cases by day. And then there's also some new tabs that you can look at that I think are comparing. I'll be honest, I'm not 100% sure, and I can't read that. No, I can't read that close. Their date we received, date recovered, and then there is a map per census tract that we are using DHS, the state department's map that they have. Next slide, please. So I really want to give Lori Diaby the opportunity to talk about this a little bit. I don't think we've done a fantastic job at really diving into data and really taking a look at where our data is at. Per day or per week basis. So we wanted to provide you with a brief update about what kind of data is looking like. So we have number of, and I will let Lori talk, I'm just going to quick explain these. We have on the top slide there, or on the top graphic there, we have the number of tests per week, which is great, and we're happy to have that, but I will let you know that I am not 100% confident we have represented here in this graph. And that, of course, goes back to our little friend, the river, that we talk about, and I've often talked about during this response. So if a St. Croix County person is to get tested out across the river in Minnesota, we do not get reports of negative test results back from Minnesota. So just so you know that. We also have number of positives per week, so you can kind of see it. Now, I know everyone's gonna think, oh, we hit our peak and our peak is done. I'm gonna caution you not to look at that graph that way, because although we had 10 cases in that 1 week, I would not be confident that we could say we've hit a peak and we're on a downhill slide. When this is really only 4 months, even though it feels like 12, it's a very short time to be thinking about a pandemic. So we will likely see peaks and valleys when we look out a year from now about how our cases are positive. Sorry, that wasn't exactly what I wanted to say, but I anticipate we will see peaks and valleys related to positive numbers. And the percent positives is obviously, Lori did a great job calculating. So the percent positive per week divided by the percent tested per week gives you your percent positive. So you can kind of compare the graphs by week to week and look at, yes, again, in that 4th week of May, it looks like we had our highest percent positive. But again, take that with some caution, knowing that this is a pandemic we've never seen and a disease we haven't ever seen. And I don't think we're going to see a traditional bell curve of a peak like we do in flu season and then the downward trend. I just don't anticipate that. Next slide, please. I think I'll let Lori talk because you guys probably don't want to hear me the whole time, and she can really talk about kind of where this data came from and how she pulled it.
Hello, everybody. So looking at those the slides in front of you with the 2 graphs, we took all of our positive cases that were in WEDS and just broke them down by age group, by decade, so that you can see who has tested positive in our county. And it's interesting to me that the largest one is in the 20s. And then we also did the same thing by gender, male and female. And nationally, I've looked at data that also has indicated that COVID seems to be affecting males more than females. Not quite the difference nationally as you see here in St. Croix County, but that would be consistent with what's being seen across the country as well. And then the next slide, if you go to the next one. Yeah, okay, this one, it takes a little bit of finesse for me to explain. So the first box is nationally. This came from CDC, so it's all the cases across the United States, and it's broke down by race. And of all the cases, there was race data available for 48% of the cases. So if you add the percentages up that are listed for each race breakdown, it equals 48%. And so it gives you an idea of the spread across the country. And then on the right-hand side, the 2 boxes there, in our system, Wisconsin Electronic Disease Surveillance System, where we're reporting our positive cases, the nurses ask 2 questions. They ask about race and about ethnicity. And so they don't exactly line up with the same as the way CDC is reporting them, but together, I think it paints a little bit of a picture of what's happening in our county. And again, for the 2 slides on the right, for race, 83% of our cases did report to us what race they felt they fall into among those categories that are listed. And then for ethnicity, 80% of our cases reported which category they fell in, which is not Hispanic or Latino, or Hispanic or Latino. And on the left-hand side, I put a link to the U.S. Census data for St. Croix County. And you can go there to see that in St. Croix County, our breakdown of non-white Hispanic is about 2.4% of our population. And so it gives you a little bit of an idea that this disease is affecting minorities at a greater rate than whites, which is also the trend across the United States. Next slide. Forget where we're at. Okay, so this one is a little bit simpler. It's not diving into that kind of data. We've had 578 COVID contact investigations. So when a positive person receives their results, we interview them and find out who their close contacts are, people that have been within 6 feet for more than 15 minutes. And all of those persons are tracked by our public health nurses for 14 days while they're in home quarantine. And so we've done 578 of those. We've also responded to 238 concerns, complaints, and questions about COVID. And we have a system set up where we're using a COVID phone line, an email address, and a web page to streamline our response. We've had 780 phone calls. We've had 229 emails. These are specific to COVID. And our web page has 109,988 page views as of this morning. In the course of our positive case investigations, we've worked with 20 plus St. Croix County businesses and some also additional businesses into Minnesota as well as out of county businesses. And what we're doing with the businesses, if there's a positive person that's been to work while they are in their infectious period, the employers are notified so that they can also work with the positive case to identify any close contacts that may have been exposed at the workplace. And those investigations are time consuming, and it's an important component of our efforts to control the spread of COVID. Next slide. I think Kelly will maybe jump in on this one. This is hers.
Okay, I see our first typo. I want to talk a little bit about our partnerships with COVID. I think it is really important to stress, and I want everyone to know that we're working with a variety of internal and external stakeholders. We have internally, I'm not even sure there is a department we haven't worked with in some fashion during this response. I didn't put the highway on there, and they were absolutely a key partner for us when we had the National Guard here and did our community testing sites. Community development, I'm really sorry that that didn't get caught. External outside county structures. This is important to think about because we can do everything we want internally for a nice, smooth response, but we really have to take a look at what's going on adjacent to us, across the river, north, in other areas, because what I think as local health officers, we have calls every day, and we want to remain as consistent as possible as we can as we work through this response, so people aren't seeing a lot of differences among counties. And there are going to be differences, but I just have listed there out of kind of all the external partners that we're working with. Obviously, hospitals, clinic. We can have a presentation from the Western Wisconsin Public Health Readiness Consortium. They are a consortium that we started being a part of about a year ago, and their whole goal of being a member is to update our emergency preparedness plans as well as exercise together and plan together. It has been valuable in my eyes, being a part during this COVID response to being a member of that consortia. We are holding weekly calls with long-term care and assisted living facilities, as well as hospice, and our medical examiner and emergency manager join us on that call. Local law enforcement, I am on every other week Chiefs call that previously was weekly. So giving updates and then answering any questions or situations that they're running into related to COVID. Our area businesses, as Lori mentioned, we have worked directly with 20 plus that have had positive workers within their business, but we are also trying to do a better job at public-private partnership. And on June 25th, we will be giving a presentation to and for members of St. Croix County Economic Development Corporation. Did I get that right? And that really was orchestrated with our chair, Dave Osnes, as well as Bill Rubin, who is the director maybe of that. I'm sorry, I apologize for not knowing the correct terms. So the plan is on that day is to give businesses kind of an overview of what would happen if you did have a positive person test in your business, and then focus on how to keep their employees safe and safeguards to ensure that that happens. So that is in the works, and that will be happening on June 25th. School districts and public health have been meeting for the last 3 weeks. Lots and lots of questions coming from our school districts and not a whole lot of good answers coming from local public health. We're doing our best, and I am advocating for school districts, obviously in St. Croix County as well as across the state. Guidance has been slow to come out, and I think they're really in a bind looking at summer school and then options for fall. State Department of Health Services, Division of Public Health specifically. I do talk about this a little bit on the next slide. And I was able to have a very productive call with the Minnesota Department of Health to get kind of an explanation or rationale as to why we weren't getting reports super timely from Minnesota for positive cases. I had a conversation with the supervisor of the epidemiologist unit at DPH, and it was a good connection to make, and we continue to be in conversation related to all kinds of different case situations or shared if we have employees from St. Croix County who work in Minnesota and vice versa. So that has proved to be very helpful. Next slide, please. So collaboration with state resources, obviously Wisconsin Emergency Management is leading this response at the state level. They did open their Emergency Operations Center where many people from different departments and divisions across DPH, DOA, DQA sit. So that is kind of the central piece of where some of those state decisions are being made and being ran. Obviously, the Department of Health Services is a huge umbrella, which the Division of Public Health falls under. I did want to let everyone know that I did think it was pertinent and important that I did volunteer to be one of a few health officers on a statewide testing strategy group. DHS has really tried to manage the response in different segments or different areas. And I felt like the statewide testing strategy group was one I should really get on to advocate not only for tests for our community, but also for our hospital and clinic partners who have been wonderful in helping us get people tested. So I just thought that was worth sharing. And obviously our long-term care and the healthcare center looks to the Division of Quality Assurance as their state kind of resource. So definitely participate. We have someone here in public health that participates on all those calls. So we're trying to hear the same messages coming from multiple places out of multiple agencies. Next slide, please. Okay, so kind of funny, but kind of not that this slide is blank. I really had hoped to put metrics on here, the current metrics that we have at the state level, as well as local metrics that we are talking about. I think it is $1 million question right now that people are asking, how are you going to make decisions, and what decisions, what are you going to use for metrics to guide you in those decisions? And because the state hasn't come out with any really simple or easy metric, each local health department has been left to decide what metrics those are going to be. The state is working on what they hope to serve as a baseline for individual counties to use. They aren't out yet. And honestly, I was going to put this on a slide. I just ran out of time today and was not able to update you. There are still 6 criteria that are on DHS's website, and they focus on epidemiology and surveillance, public health, and the capacity to contact trace, and then as well as the healthcare systems. So I don't think we're going to do anything crazy and vary a ton from what others are measuring and what we are looking at. My concern is a mechanism once we use those metrics to inform our guidance to potentially increase mass gathering guidance or advisories. There's really not a mechanism put in place that triggers tightening that up again. It's concerning to me, and yeah, we'll keep trucking and moving along. So hopefully, yep, great. Stay informed. You've seen this slide, you've seen these websites. And then my last quote, which is very fitting, that I had not even known that this was a reiteration. Thank you, Debbie. She's helping me get through my day. By Malcolm X. I put this on before any of the craziness started with protests. And I think it is quite fitting and pertinent for where we are at today. That's it.
Any questions or comments?
I have.
Okay, Greg, go ahead.
I'm really concerned about assisted living and health, nursing homes and so forth. It seems like the patients are getting more and more depressed. They're not getting the services they need. They're not getting the exercise. I'm hearing other complaints. Family members can't visit. Even healthcare work, and I'm just wondering, is there any better guidelines or anything they're either going to die of COVID or they're going to die of the disease that they have. What's going to happen?
Super question. What we are told by DQA, there is guidelines coming out. I know everyone, so we have weekly calls with long-term care and assisted living facilities in the county. This has come up several times. Senator Schottner, not in her medical examiner role, has also brought this to our attention. And I think what we want to capitalize on is the fantastic job they're currently doing at keeping COVID out of their facilities. And that right now is not, it's not the best scenario for everyone's mental health, for isolation, for loneliness, and we totally understand that. And I guess I would invite Sandy, if she has any thoughts on that. I just can't say enough good All of our nursing homes have done testing of staff and residents, and we have had, as a result of that mass testing, we have had 0 positives. That is almost unheard of. And we're watching different counties across the state and our neighbors and across the river not have that outcome. I'll be quiet and see if Sandy has anything to add.
It's a great question, Greg, and we struggle with that on a daily basis. We are waiting for the guidance. It's been a couple weeks that they've said it's coming on opening up and visitation. And as far as I know, it's as of the call this morning, it's at the higher levels, whatever that means, if it's at Senator Palm or at Secretary Palm's level or where it's at. But there has been some guidance that's put out by a team that was put together to help us safely do some visiting. Part of what's really hard about the whole visiting part is, and I don't know if you've ever met anybody out there, but there are people out there that believe that COVID doesn't exist. And there are other people that kind of believe that they don't have it. Absolutely, they don't have it. And we've had a couple things happen within the facility where families are safe and they've kind of bent the rules. And that's what gets a little concerning for us because we're trying to keep everybody safe. So how do we do it so that we can protect everybody, the residents, the staff, the assisted living people? Be assured that one of the things that we have done here is we have increased our activity staff where they're doing more one-on-one activities with our residents. We're doing bingo in the hallway. We did a lot of fun things where they did staycation pictures that they sent postcards to their family members. So there's a lot of things that we are doing. And yeah, they do miss their family. We are doing Duo and FaceTime with family members. And I know it's not the same, but we're trying to keep everybody safe. And, you know, the concern also is when we have COVID or if and when we get COVID is how do we keep family members when they come in safe too. So it's all in making sure that have a good plan and it's all set in place. And I did talk with facilities a little bit today about potentially looking at an outside area that we can kind of secure off and put in like a speaker type system, because that's the other thing. When you start doing this distancing, they can't hear very well sometimes. And if they're outside, there's the external noise. So looking at how we can overcome some of those obstacles. So we are looking at it. It's just being thoughtful and very careful about how we're doing it. So
I've even heard anecdotally that some places aren't even allowing physical therapists in to help with physical therapy for the patients.
And we do,
or other healthcare workers from the hospital or clinics to come in.
We actually, our nurse practitioner continues to visit, and so does our physician. And we screen them, and they go through the same screening process that we screen all our residents 3 times a day. We screen all of our staff when they come in. Everybody wears masks. I wear one at my desk 24, every time I'm here, all the time I'm here. So we do compassionate care visits. So anybody that's at end of life, we have family members that are coming in, and our residents do not pass on or die alone. Their families here. We're very careful about making sure we educate them, we give them masks, we screen them, and we have had very good success with that. So we do have our therapy here. Maybe we're a little different than other places, but this is what we're doing right now. The only thing that's really hard is, to be real honest with you, they love their beautician, but it's very clear in the guidelines that we can't have one. Yeah. So So that's difficult.
Okay, thank you.
You're welcome.
Anybody else with a question, comment? Dr. McGinnis, did you have a question?
No, I just wanted to echo a lot of what Kelly and Lori have been saying and appreciate the job that they're doing. It's a hard job, and unfortunately this virus has not gone away and will not go away in the foreseeable future. And I think that that's the hard part for everyone in the county. I think as I am out and about, the people that are wearing masks I really appreciate their care and attention to that, especially if they're indoors, but also staying home if you're sick and washing your hands and staying apart and avoiding large gatherings where you don't know other people. I think those are the things that are going to keep our elderly members of our community safe and keep the numbers as low as they have. I also reflect with St. Croix County's had its first death this week, and that's a big deal. So I think those are the things that work, and unfortunately the virus is still there.
Okay, thank you. Anyone else?
I just wanted to say thank you to everybody that's working so hard. And I really, I've noticed that, you know, as the PIO said, that since he's been working exclusively with your team. And I think that's really been helpful with reminders and helping your team out. And I've noticed it at the dashboards, really good information. And a lot of people have been commenting to me about that. So really just thank you so much for all your hard work. I know you're not sleeping, so we really do appreciate everything you're doing in a very difficult situation.
Very good, Kathy, and thank you for that. I'd also like to thank Kelly and you and your entire staff, pardon my English, but for all the ungodly hours that you folks put in, it is greatly appreciated. And keep up the good work. You folks are the best of the best. Thank you. And with that, we'll move on to item number 4. I'm sorry. Sorry, Tasha.
So I know you mentioned the contact tracing efforts are really extensive and labor intensive. Are we still in the process of hiring more people to do contact tracing? Or what does that look like right now?
Yeah, that's a great question, Natasha, and I appreciate you asking it. We are down on our end. We had one of our ends retire in May. And we have been operating since May 16th without that person, actually likely a little bit before then. So not even thinking about extra people, we are down one full-time nurse. However, we do have the lovely Deb Lindemann and Sharon Razor, who have stepped up and come back on a limited term basis for us, which is helping some. But it is not helping enough. So what I have kind of been waiting for is about a month ago, the state, or even more, the state had a job description posted for contact tracers across the state, and they opened that up statewide. And we have been told multiple times that if there are people in your area vicinity that have applied for those, we are going to get you the resumes. And I was told at a call last night that the state thought that was all ready to go, and we should be hearing this week related to anybody who has applied in our area. I think there absolutely is there's been a lot of talks about it, and it's honestly finding time to sit down and doing it. And I know it has to be a priority because we can't keep going like that. So thanks for the question. Also quickly, we have had some of those conversations at the high level of all of our hospital and clinic CEOs, and thinking about could we utilize some of their furloughed staff? And I think that could be a real viable option for us, plus great partnerships around the county. So.
Thank you.
Anyone else? Pat, you got any comments at all that you want to throw in? No. Okay. Okay. Bob, anything? Okay. All right, with that, then we will move on to our next item, and that's the healthcare campus service changes. due to COVID-19. Sandy?
Well, as you know, we are still on lockdown where we do not have any visitors at this time. And just a little bit, we have tested 120 residents and staff members, and they're all been negative, which has been a fabulous thing for us. And it was almost 100% of our staff voluntarily tested for the first round. We do not have guidelines right now. There's some federal guidelines to the state and local, what they might consider recommendations. But I think Kelly, you're on the testing site, I believe, looking at how that looks for the state and how that looks for healthcare and nursing homes. So we're still kind of waiting for a lot of guidance for some of the changes. We have had a change in our admissions. Our census is down related to our rehab unit because the hospitals are now just starting to open up and do some of those surgeries that they weren't doing, such as total hips and knees and the rehab patients. And our Kitty Roads unit, we did manage to, as we've talked about for the new board members, we talked about moving our Kitty Roads unit up to the second floor of Orchard View. And then we were going to look at opening Kitty Roads as a behavior dementia crisis area where we could take residents with behaviors. The unfortunate part is COVID came about. And as you can quite imagine, residents that have dementia aren't too keen on wearing face masks because they don't understand what that is. And then, so it's really difficult to even consider opening that type of a unit that we really couldn't potentially keep people safe in. So we are looking and reevaluating our Kitty Roads unit, which right now is empty. There's no one in our Kitty Roads unit. We have 22 people in Orchard View right now. We continue to admit to Orchard View. We admitted somebody yesterday and last week. So we continue to do our admissions, and we're careful. We try to quarantine people. Right now, they're asking us to quarantine people for about 14 days when they come in. Everybody's aware of that prior to coming in and agreeable to it. And that's how we're proceeding. We're not doing tests all the time. We'll have to wait to see what happens with that. And we'll continue to hope for those guidelines to come out soon. So does anybody have any questions about the changes or what's going on?
Sandy, this question is probably not, well, it doesn't really pertain to the COVID, but for our new members that are on the board, when we're talking about adding folks into Orchard View, do you want to kind of explain how we finally got to that process after about 4.5 years with our certification?
Oh, yeah. So we actually I don't know if you guys have ever heard of something called heightened scrutiny, but the board members that have been with us have heard about it for, it's about 5 years. We were working with the federal government because there was a change to the regulations on family care, the use of family care in a CBRF or assisted living facilities. So we just received the certification that we could go ahead and admit people that received family care or public funds, basically, to our CBRFs in January. And then we made the plan. It was we made the plan to move them up to our Kitty Roads residents where we were basically running as a memory care up to our second floor. And then we were going to open our, Kitty Roads unit with our family care residents mostly. The unfortunate part is when COVID hit, it kind of changed everything. So we worked very hard to get our okay and our confirmation that we could be certified for the waiver, the home and community-based waiver. As a matter of fact, just yesterday, the state contacted me because they're giving a report to the federal government today. So on our progress. The unfortunate part is there's no survey, so we're doing this all by paper and electronically. So it was a long road, and I thank everybody that helped us. There's a lot of board people, a lot of people that really helped us with getting our heightened scrutiny through. Unfortunately, right now it's but we really do have, right now we do have, just so you know, we have 6 people that are family care in our Orchard View facility that wouldn't be able to utilize those services in our facility if that wouldn't have passed. So that's good.
Any other questions? Comments? Okay. Thank you, Sandy, and thank you to the staff up at the Health Center. You guys are doing a great job as well. We greatly appreciate all the work that you folks are doing. We'll move on to our next item is the presentation of the 2019 Health and Human Services Annual Report. Bob?
Thank you, Chair Osnes. The annual report, the 2019 HHS annual report's contained in your packet, and I hope you've had a chance to look through it and maybe you have some questions. Before I start, I just wanted to say that I'm in the process of meeting with all of the administrators, the division administrators in Health and Human Services, and I plan to meet with their teams going forward in the near future. But I would like to comment and probably just reaffirm what you already know, in that this is a team of individuals that I think are dedicated and compassionate, and I think they're uniquely qualified to lead us through this challenging time. And I wanted to thank not just public health, but I've been working with Kelly quite a lot recently, but all of the divisions within human services, because I've just been impressed as an outsider coming in as to how just how impressive they are really as professionals and as just human beings, really. So with that, in reviewing the annual report, I think it begins on page 14 of your packet, if I'm correct. Hopefully my notes are right on stuff. No, that's probably not right. Is it, oh, the packet page is down there. Yes, so on page 14 of the packet at the bottom there, the annual report begins. I thought what I would do, Chair, if it's all right, is point out a few items within this summary that I thought the board might be interested in knowing. It's also an opportunity, the entire report's an opportunity to provide an overview and some orientation to new board members as to what the various services are and some of the measures that are used to indicate outcomes within the report. If I can reference a few specific items, then I would open it up for questions for any broader kinds of questions you might have. And I've also invited the division administrators to participate in tonight's meeting so that if I don't know the answer to something, they likely will. And I thank them for spending part of their evening with us. With that, then I'll just move into a couple of points I wanted to make. On page 29, that is the packet, page 29, the intoxicated driver program, I know there was some questions, I believe, at the last board meeting about the wait times associated with that program. And as you can see from the report, those wait times have gone down substantially. The most recent data from that program of June 8th, actually the day I started here, the wait time was at 10 days. So they were able to make adjustments within that program to bring that wait time down, which I believe was a concern previously. Also, I wanted to just point out quickly on page 37, let me get it too, so I can be articulate. Under economic support, I wanted to just point out the fact that St. Croix County is one of 10 counties that make up the Great Rivers Income Maintenance Consortium, and they provide direct services to residents of St. Croix County who meet eligibility guidelines. But the pie chart on page 41, I thought, gave a nice summary of how those expenditures that are reflected, the expenditures, benefit expenditures are reflected, and what those expenditures go towards in the community in terms of helping not just the most vulnerable among us, but go towards hospitals and businesses, daycare centers. As you can see from the pie chart, the breakdown of the amount of dollars that go towards those areas that benefit not just the folks that we support, but the community itself. And I think one other item on page 50 that I wanted to point out as a part of, in talking with Sandy today too, I think I said I was going to mention this. If I get to page 50, at the about the middle of the page there's a bar graph that shows the CMS rating for the healthcare campus at 5, I believe, is the highest rating you can get. And they've received that rating every quarter for the last 3 years, 2017 through 2019. And I thought that was worth mentioning. I'm not an expert in what it takes to get that kind of a rating, but I've talked with people who are, and they said that's pretty impressive. I thought that was worth pointing out. And finally, that might be all of the points that I wanted to mention this evening. But again, just a big thank you to all of those involved in putting this report together. It wasn't me. I came in when it was a draft, and they said, "Do you want to approve it?" And I said, "Well, it looks good. I think so." So that was my first decision, I believe. But if you have questions specific to this report, anything within it, if I can't answer them, one of the division administrators might be able to answer them, or we'll get back to you with an answer. Thank you.
Very good, thank you. Any questions, comments? Yeah, go ahead, Kara.
I'm not sure if the right person is on the call tonight or not, but I'm looking at the 2019 benefit expenditures for economic support that Bob referenced, and I'm wondering, I know this isn't a summary question, but just kind of looking at the future, we know that COVID has impacted a lot of folks as far as their jobs and their livelihood. And are we seeing any projected increases or changes, significant changes going forward for 2020 at this point, or is there increased demand for those services or assistance in any of those categories right now? I don't know if anyone's on that can answer. But
I think Rhonda is on the call.
Yep, this is Rhonda. Can you hear me? There have been several federal and state changes in program policy, mainly to keep individuals on services at this point in time so that they're not losing healthcare, access to prescriptions, food, etc. during this time frame. So we're just starting to see an increase in applications as some of the state changes were undone. However, there's still federal changes in place that are allowing us to push renewals out, for example, so individuals stay eligible for services. We're seeing obviously a lot of reports of lost employment. So we're seeing a lot of change reports for individuals that are receiving services. And then in addition to that, there were emergency food share and then also pandemic EBT food share. So there were a couple additional programs for individuals who are receiving services, some not necessarily on food share, but receiving free and reduced lunch, for example, through their school district. So, how this will look, I think our workload has been affected more than anything, but that hasn't necessarily been by an increase or decrease in recipients, more so due to changes in programs and policies that we're just trying to keep up with. and that we expect to continue at least through the end of this year, and not really sure how it will look going forward. Does that answer your question?
Yes, it does. Thank you.
Anyone else? I've got a question for Julie. With the COVID and moms and dads that are at home and now the kids that are at home, is there a concern that any of our social workers are having on any of the problems that are happening at home up and above what we've had before? And where are we going to be going with that?
Hi, I hope I heard your question right. So what has happened is when school have closed, our mandated reporters went down. So we were concerned that a lot of the issues were not being reported to us. So we tried to do a bunch of messaging with key people to get the word out on how to report child abuse or neglect. Certainly our referrals to CPS has decreased during this time, but what has increased has been the complexity of the referrals, especially in the area of domestic violence and children witnessing that. And I apologize if I didn't hear all of your question.
That's fine. You keep going.
And then also, this pandemic has not stopped substance abuse in our community. And so we're continuing to have that trend that we've talked about at several board meetings with methamphetamine and alcohol use. Our child protection has continued to operate as it did prior to COVID. Other than we are partnering with public health a lot on making sure that staff are equipped with the right PPE, and then also doing some tracking about positive COVID cases in our community. And then our ongoing child protection, we have done some modifications in regard to family interaction, and as well as we've done a lot more telehealth visits with families versus in person, but continuing to assess all needed safety in person. And if I didn't answer your question, please repeat the parts that I didn't answer.
With the caseloads, how is that working if we've got the upstairs closed down with the court system? What happens in that case where we need a special placement for some of those kids? What's the process now?
The courts are still open for our services. That has not stopped one bit. What has happened is just how those court hearings work. Some is done through technology, and some is done in person with families as well. And that's really upon the discretion of the court. But we're continuing to operate business as usual with the courts and getting cases in within those 24-hour time periods with custodies and the like.
Okay, thank you. That's very good to hear. I appreciate hearing that. Anyone else? Go ahead, Julie. I'm sorry.
The only other piece to take note during this time is if we do need a placement for child protection or youth justice, there are different screening criteria that we need to follow if kids go into a placement facility or within our own foster home system. And oftentimes, they would need to be medically cleared for COVID, especially if they're going into some type of facility care. And then also some of our facilities have stopped taking new kids, primarily some of our secure detention facilities because of COVID, but we've been able to work through that with some other arrangements. But good questions.
Thank you. I appreciate that. Anyone else?
So Julie, you mentioned that the number of the reporting has gone down. Can you give like a number to that? Is there a percentage of that it's fallen, or how much has it changed?
We have seen about a 30% drop in reporting, which is pretty significant, but statewide numbers are a lot higher. One of the things that has happened is I think that people are calling the police instead of calling us. And so then our law enforcement officers are reporting this to us. So that has, I think, offset some of the numbers. But certainly when the majority of your mandated reporters are teachers and school counselors, that's just a pretty significant reduction in reports. So we know we're missing some just because they're not being reported.
Sure.
Anyone else?
Chair Osnes, could I make a comment? I just wanted to say that having just come from Hennepin County, we looked at a lot of data there around out-of-home placements and what were the main drivers behind that. And it was the same primary driver was substance use. So we were involved, or I was involved with some efforts and had the chance to talk with Julie earlier today about the need to develop some, or try to develop some interventions that might address that issue. It isn't just St. Croix County, that's a widespread problem that we've been studying for some time now. It's time to do something about it. Thank you.
Good. Thank you. That's great input. Anyone else? Okay, thank you, Julie. Let's go on to item number 5. Faye, you want to talk to us about our finances?
Sure. So within your packets, we have a copy of the financials. Are you able to hear me okay?
Mm-hmm.
Okay. So overall, our state revenues are similar to where we were last year. The revenues that we receive, I've mentioned that in the past for state revenues, are a couple of months behind just the way the expenses come in. We fill out claim forms and those go to the state to get reimbursed. We have seen a reduction in our local revenues. So the local revenues are money from the services that we provide, either through the outpatient clinic, through reproductive health, ADRC, the donations they receive for meals. So those are all of our local revenues. They are lower again as services have decreased in the way that we're providing to them. They are, the managers and staff within those departments have worked really hard to find alternate ways to provide those services, and they are continuing to increase. I don't know that we'll ever be back up to where we were, but again, they're doing everything they can to make sure we're providing services to the people who need them. So those revenues are down, and we'll talk about in the future or later. I have some other information about those. So expenses, for the most part, have remained steady. A lot of our purchase services that we get are not impacted through COVID. So we're still having out-of-home placements, as Julie talked about. We still have residential treatment for substance abuse. We're still having hospitalizations that we pay for. So those purchase services continue as they did. With the decrease, so that's really all I have on the HHS overview. When you look at some of the specific departments, you do see some negative numbers here and there. A lot of that is due to either changes in how we did services since the budget was presented. We budgeted on a certain line and then had additional expenses or revenue streams come in. So we're recording those expenses on a different line, or it's just due from, we record expenses where they happen and we had expenses at someplace we didn't anticipate. But overall, they're, as we expected. One of the things that we've been doing is applying for additional funds through the Families First Coronavirus or through the CARES. So many of our departments have received additional funds. We have some for public health that we'll be using to pay for that contact tracing that we need to do. ADRC received additional funding to help with the home delivered meals that they're providing. Mental health and substance abuse, we're applying for supplemental to cover some of the technology that we've needed to put in place to continue to provide those services. So that will help, cover some of those decreased revenues that we had and those additional expenses that we've incurred. And then we're going to skip down to the health center campus. So Sandy provided a pretty good explanation, that we've had a reduction in our census, so their revenues are down. This report, although it goes through May of 2020, does not include the May revenues. They were posted after this report was run. So there is an additional $456,000 in revenue that would be applied across the campus. Hopefully next month we'll be able to get that in a little quicker, and we'll have this report up to date for you. The nursing home also got additional funds to help cover that reduced census and the increased expenses that they've had from, again, Sandy mentioned the extra activity staff. They have CNAs now delivering meals to people instead of eating in their rooms. So, they have full staff to keep providing those services to the residents. That money right now is in a deferred revenue account. As we track the expenses and track those losses and revenue, we'll move that from deferred revenue to regular revenue. So Kitty Roads, Sandy mentioned that we have moved the residents out of there. They do continue to accumulate some expenses within Kitty Roads, and that's because we still have electricity running. There's, just minimal expenses that are allocated to Kitty Roads because it's part of the campus. So no new revenue coming in, but there will be some minor expenses that still show up in Kitty Roads. And then Orchard View, as she says, they're getting some admissions. It's not quite where we had budgeted yet, and hopefully that will continue, to increase the revenue as we go through the summer and into the fall. So veterans, Phil does an awesome job. They are right on track, so their revenue is where we expect, and he has very little outside of the normal with his expenses. The last slide that we have is just our purchase services. This was a slide we developed just because that is the biggest driver of the operating expenses on the Health and Human Services side. So it's just so we can monitor that trend of where we're at, and if there's, valleys and peaks, so we can report to you and alert you that, they're there. Does anyone have any questions for me regarding the financials?
Questions? Faye, I've got a couple for you. As long as you got the vets on there right now, I guess I've got a concern with, we're way down on our getting our vets over to the VA, since that's basically closed over there. So we'll have money left over, state funding left over for that. Will that affect us in next year's budget to the vets? Will the state cut us just to the point of actual mileage or whatever we're using this year? Do you know where we're at with that?
And did Phil participate?
Pardon me?
I don't believe, in my conversations with Phil, the way that he manages the state grant is that is staff salary and fringe, and then the other services that are provided are really coming out of the property taxes, so that if there's a change in the level of service, it will not affect the grant the following year. So when he has to prepare that budget and submit to the state how he's going to spend his money, he does that in a very planful way. So if there are changes like happened this year, it will not affect the grant going forward.
Okay, and then shame on me, I should have been talking with Brad about this one too, but services that we're providing are way down right now with the van use at ADRC, and that's usually based on your usage from the previous year on what you're going to receive next year. So if we're way down this year, I'm assuming that our state check coming for mileage and everything else for those drivers is going to be way down next year then. Is that correct?
So, and Brad, I don't know if you're able to comment on that or if that would be something that we would have to go back to Amy to get additional information on.
I couldn't hear the question, Dave.
It was one of those that if we're down right now on servicing folks for the different services that we have, are we going to be cut in funding coming next year from the state just based on we're way down this year on what we were actually funded for?
And I think the answer would be no, because we've already been budgeted for 2021 with the 8521 with an increase. So I don't think that'll be effect on the transportation. And now they actually are starting to transport people. So that piece, yes, it's down, but I think it will go back up again. So does that answer your question?
Yeah, okay.
Okay.
Thank you. Any other questions? Okay. And we'll move on as soon as I get my agenda in front of me. Review of capital improvement. Mr. Ken.
Yeah, I'll come up to the podium here, get the blood flowing back to my legs. Not that you run a long meeting, Dave. So the capital improvement program, so this is an initial review. We're going to take a look at the different capital projects that are on the schedule, any new projects that are coming up on the schedule that are under the jurisdiction of the Health and Human Services Board. So I've highlighted those for you so we can easily identify them. The first one on there is out in 2023, we have a Children's Services Office build-out based upon future projected staffing. We kind of estimate when we need to expand office space. So that is out there a couple of years, and it's been on the schedule. We get down to the HHS block of projects here. We have senior center kitchen upgrades. This is the next 2 years out of a 4-year cycle that we've been putting money into upgrading the senior center kitchens. We had started that in 2019 with the first year funding. They actually held that into 2020 this year to make those improvements, basically because of economies of scale. And we have 2 more years worth of planned upgrades to the equipment in those facilities. We have additional HHS office build-outs planned for 2021 on here. We have a couple of health center campus projects, a patient lift, and some dishwasher replacements over the next couple of years. And then the one project that's new on here that was not on here previously is the service center speaker system. I have it budgeted at $40,000. We've been taking a look at the bids. I think they've been able to cut some stuff down. I think that's going to come in under $20,000 now, so we'll adjust that number. But that's a new project, and so we're kind of fitting it into 2021 based upon the need of the project rather than putting it 5 years out. And since there aren't any new revenues coming into the KIP, it's kind of tough. So I actually had to call a friend of mine. I called up Chuck Norris and asked him how we could fit this in because only Chuck Norris can divide by 0. So he was able to help me out and get that in. That's a math joke for you guys, divide by 0. But somewhere Fred is laughing because he's the one that gave me that joke. And then the last one for HHS is the ADRC. So we have a rotating cycle for replacing those vehicles. And so we continue to fund that every year with the rotation of the vehicles. So that's all I have to report on the KIP and all the jokes that I have for you this evening also.
That's short and to the point, aren't you? Thank you, sir. Questions? Comments? Concerns? You're good to go, sir. Thank you. We appreciate that. We're going to final item, Health and Human Services Board Member Orientation Planning. Bob.
Thank you, Chair. What we had talked about in the time I've been here as a possible way to orient board members, new board members, excuse me, would be to propose that we have our division administrators provide about a 10-minute presentation each on their division, splitting that up between July and August, if that is something that sounds like it would work. So we would have roughly 3 or 4 presentations in the month of July and in the month of August to give you a little more in-depth understanding of what those divisions do and how they do their work. If that's a proposal that I wanted to bring forward as a way to orient board members.
And I'll throw it out to board members. Comments?
Fantastic idea. It gives all the board members the ability to meet the division directors, get familiarized with all of the resources that are offered through HHS St. Croix County. I think this is a fantastic idea.
I agree, and it's even good for us who've been on here too. We learn all of it, so thank you.
Carol, what do you think?
Sounds good to me.
Okay. Any comments from the folks? Kathy, you got a comment?
No, I think it's a good idea. Oh, I always have something to say, but yeah, I mean, I'm looking forward to it, the orientation, getting going and acclimated. So yeah, sounds good.
Oh, how would this orientation take place? Over Zoom or in person?
What was the question?
Zoom or during.
I can't hear you.
I believe the idea was to do them via Zoom in this kind of an environment. So
Well, it's difficult to hear the boardroom. It hasn't gotten any better. And so if it's all going to be, everybody's going to be on Zoom, great.
Okay, I think we'll work at that. All right, Greg, we'll see if we can get something better for you guys, if that's okay.
I mean,
And are you okay if we take a couple different groups at each meeting, just to kind of give you new folks an idea of what they do and some of the other things? And if you've got questions for those different group leaders, you're all right with that, Greg?
I'm all right with it if I can see somebody and see who they are and where they are. I don't even know the facilities.
Okay, we'll work on that one.
Maybe you could do a video of everybody and send that out. Each person does a video.
That'd even be
And
better.
then you could play it on your own computer.
All right.
Okay, that's something we could probably look at. Bob, you okay with that?
yeah, if you can give me a chance to look into how that might be done. Yes.
Did you hear
Tasha,
that, Dave?
what's that, Deb? Deb, I didn't hear you. I'm sorry.
I had the suggestion that maybe everyone could do a video. Each of the managers could do a video, and then you could send that out and you could watch it on your computer.
Okay, that's a good idea. Tasha, what's your thought?
Well, I was just going to ask, is the boardroom, I mean, you're able to see us. Are you able to see people presenting pretty well?
That's another good point.
For example, when Kelly was presenting, I mean, when we see it on Zoom, that's really easy. If someone's participating, I think, through Zoom. So if the boardroom can see that really well, maybe the managers just should plan to do it that way. Because then we can hear really well that way, I think.
I agree.
Okay, that's a good idea. Dr. McGinnis, what are your thoughts?
I think this is a good way to orient people, either by the in-person presentations over Zoom or by the videos. Either one would work well. I think that I would agree with Greg's comments that the audio from the boardroom is difficult because I think the mics are not adequate for what we're doing. If people are talking on Zoom, that comes through others on Zoom very, very well.
Okay, and we're going to catch the staff members too. Kelly, what's your thought coming from public health?
Well, there's a reason why I'm only in a room with 3 other people who I've spent the last 4 months with. So I think Zoom or video would be great.
Okay, that sounds good. Brad, your thoughts?
No, I really like the idea. We've started that at the ADRC too with the orientation. my suggestion would be if the person that is doing the speaking would actually come to the meeting, if you're social distancing one or two, just so you have a live person that can talk, or we can do it on Zoom or whatever. But I just think having a live person there, you can talk and you can ask questions and you can be more connected, because I agree, I'm having a hard time hearing when people are speaking, so.
Okay, thank you. Julie, your thoughts?
I like the idea of Zoom, just for the quality of the hearing. Like I said, echoing, we can't really hear what's going on in the boardroom all that well. And then at least if we do it by Zoom, then there can be a little bit of interaction where if you might have a question about something we've talked about, there can be that dialogue back and forth.
Okay, Sandy, your thoughts?
I'm with Kelly. I think that Zoom is a really good way to do this. And yeah, it is hard to hear the boardroom, and I just think it's just so much bigger. And it's just not focused sound. So or a combination, showing for the health center, I'd have to do like a combination so that you can actually see some parts of the health center. So I would probably suggest some of us might do a combination.
Okay, Kristen, your thoughts?
I would echo what everyone else has said, in that I think Zoom is the most appropriate, and in that it's really hard to hear what's happening in the boardroom. I think this is a really good platform for us to be able to share information, and if we need to do a video, we can certainly share it on Zoom as well.
Okay, Tammy, your thoughts?
I would agree with the rest of the group. I can show myself. There we are. I have a little bit of sun coming in through the window, but I agree with the interaction, what Julie said. I would welcome questions, absolutely. So I like the idea of Zoom and the interaction.
Kathy, what's your thought?
I would prefer Zoom as well. Julie kind of took the words right out of my mouth. I think interaction is important, that you would lose some fidelity in a video because there isn't that ability to ask questions or follow up with something that we might share. So I would vote Zoom.
And Rhonda, what's your thought?
I agree with what everyone else said. Zoom or whatever. Microsoft Teams would work well too. You can record easily through that with translation. So if someone were to miss the discussion, they could easily watch it too. So.
Well, and Kathy, or Rhonda, you know that when you're here in person that we do a lot of biting. You know that, don't you?
But you do what?
We do a lot of biting. You know that, don't you? And Becky, what's your thought?
I am okay with either option. I do think Zoom allows you that chance to be interactive, so I think that's good. As the newest administrator, I think here, I may not know all the answers to your questions yet, so you'll just have to grant me some grace, I guess.
Very good. Thank you, everyone. We'll take that into consideration. Bob, anything else?
I don't think so, Mr. Chair. Thank you.
Okay, we're going to move on. Any requests for future agenda items?
Yes, Mr. Chairman. I'm requesting that at our July meeting that we do have a discussion with possible data presentation regarding the mental health issues, drug and alcohol issues that we are currently not covering within St. Croix County for the homeless populations and also for those populations which are underserved simply because they are not on the radar of county service agencies.
And I guess for the sake of Mr. Strom, we should
talk into the microphone.
We should be updating any response from the Wind Sighting Council that we've sent letters to, and if they ever did meet.
Okay. Anyone else?
What did Paula just say? I didn't hear her.
I said that we should update any news from the Wind Sighting Council. That we've written letters to them, and they haven't met in years.
Looking towards the colder months, what is the homeless population like? And is there any drop-in facilities for them? Not Grace Place, but just a drop-in similar to what Eau Claire does or something.
I can provide that information to you, but because this is not an agenda item, we cannot be taking this into discussion.
We'll put that on the next agenda, Greg. Is that okay with you?
Yes, I don't know what Scotty said either, so.
Okay, thank you.
You can't hear.
Anybody else?
Chairman Osnes, one of my questions would be either to Kelly or to the sheriff to speak a little bit about how they're managing COVID and managing the inmates in the detention facility, as obviously that's been a source of a lot of outbreaks in other areas.
Okay, that sounds good. Kelly, you're on that one. Anybody else? Nothing else? Announcements or correspondence? Bob, do you have any announcements?
I don't think so, Mr. Chair.
Anybody else wish to make an announcement? Seeing that, our next meeting will be July 15th, 5 o'clock, right here back in the boardroom. We'll be on Zoom again. And our meeting is adjourned. Thank you, everyone, and thank you, staff, for all your time tonight. We greatly appreciate all your work. Thank you, ladies.